And what event did you attend today?
The Move On rally for public health care option.
So you came out in support of the public health care option?
Yes, I did.
Well, about the public health care option, what specifically led you to come out today, and what do you want that public health care option to be?
Some way of it in ensuring that people in this country get decent access to medical care. Since for years and years in this country, we've depended on employer supplied health care. But the employment scene is changing. We're losing a lot of the big industries and the huge factories that once employed thousands of people and provided that kind of, I guess for lack of a better term, institutional coverage, which means that a lot of people are going to be working for small businesses or working on their own and aren't going to have, access to affordable health care anymore. So, I believe the purpose of the government is you can't stop change. You can't turn back the clock. The purpose of government should be to try to mollify as much as possible, the negative consequences of economic and technological change. And the way I see it is because of the fact that not as many people are able to get health insurance through their employer anymore, there has to be some other method.
So you would foresee a public option as being an option, or would you like that to be a single option for everyone, or what is your goal in there?
I think right now the idea of it being an option to keep the insurance companies honest is a good kind of a good experimental measure, and we'll see how that goes. If that keeps the insurance companies in line, then there's no need to go any further. And this is an added aside. Here in the state of North Carolina, we have a commission that regulates automobile insurance, and I don't see anybody over there protesting against that. So if it's okay to regulate auto insurance and how much people pay for that, why is it not okay in some fashion to, influence the health insurance industry in a similar manner?
Does the Department of Insurance in North Carolina regulate health insurance?
No, they don't.
They don't regulate it?
It's the auto insurance, and the commissioner of that is elected by the people, so if I recall correctly.
He is the auto insurance commissioner?
Yes, I believe it used to be Jim Long, I'm thinking.
Well, as far as the plans that are being proposed, of course, one of the things that's being discussed is cost and how do you pay for it. And there's a lot of different ideas that are being suggested. What would be your preferences to how to achieve the universal care and to pay for whatever the cost might be?
Well, first of all, we all pay for it anyway. The argument that I don't want to pay for your kids' health care is ridiculous. Hospitals, they just take the cost of the people who show up at the emergency room and can't pay and pass it on to everybody else, to the rest of us. And then there's also these indirect costs. A large number of bankruptcies are caused by people having medical bills they can't afford. And a lot of times when people go bankrupt, their home goes into foreclosure. And that's why you have these homes dumped on the market, which drives down the value of everyone's home. So we're already paying for the uninsured in this country, regardless of the people who claim they're not going to do it. My argument is you can either come up with some sort of system that recognizes these costs and makes an effort to deal with them up front, or you can just kind of allow it to play out chaotically. And inevitably, in my personal experience, when you allow something to play out chaotically, it inevitably winds up costing you way more than it would have if you'd just taken a few measures beforehand.
If you had the ability to make a decision about directing that cost, is one of the I guess ideas that's been proposed is levying a tax on employer-paid health benefits. Do you see advantages, disadvantages to that? What's your feeling on that as a concept, as a way to pay for the new option?
Well, I haven't really looked at the details of that. I can see where a lot of people would probably, not be in favor of that. I guess another way would be just to have some sort of tax on individuals, similar to what we pay for Social Security now.
Okay.
that would probably be for a system that would cover everybody.
If you did that, what would you think would be a fair amount for everyone to pay on that tax?
Well, in my case, it would probably be at least as much as what I presently pay for my private insurance. But I'd like to think also that I'd get a better deal out of it. Right now I pay, a certain amount every month, but every few years they raise it on me, but they give me an option of keeping it low if I take a higher deductible. And obviously, if you take that to its logical conclusion, I'd be paying a lot of money for no coverage whatsoever. To keep raising the rates and raising the deductible at the same time.
And do you pay for your own insurance, or do you have that through an employer?
I pay for it myself. My last long-term employer didn't offer insurance. It was a small business. It was in the newspaper industry, and they just couldn't afford, to pay for all the employees. So we had to get our own. And the newspaper industry is another one of those industries where a lot of people are being laid off from the bigger newspapers, and they're losing their employer-provided insurance.
Some on the Hill have suggested that one of the side effects and benefits, perhaps, of a public option would be reducing exorbitant reimbursement to medical facilities and doctors. Specifically, Medicare pays for services at a much lower rate than many private insurers do, so therefore the government's getting a better deal. Many are suggesting that one of the reasons that health insurance and health coverage costs as much as it does is because of compensation to doctors. Would you think that would be a positive side benefit to a public option to reduce the compensation that doctors receive?
I'd rather see the well, first of all, you also got to realize that if you go to a public auction, you cut out all the profits of the private companies and the cost of administrating that. So you've already gotten rid of a lot of overhead right there.
So would
as far as paying doctors less,
do you think that doctors' profits are high?
I don't know. I would have no problem telling people who go to medical school, hey, since your job is so important to our society, you get a free ride. You can go all the way through medical school, and if you pass, we pay for all of it, because public health is important in this country. I mean, if you're going to pay to send anyone to school in this country, it ought to be doctors.